I always call it, I always say SEMO. Is it SEMO? SEMO. SEMO. It's always the opposite of what I think.
Okay. It took you long enough to pronounce Tomaszewski, right?
Right. All right. So we are live here in Nashville, which is it's very warm here, of course, but we're at GTIA, formerly known as CompTIA, and we're at the ChannelCon 2025 event, and it's you can tell it's loud here right now, but this is nothing compared to the how loud it's been earlier with the crowds, right?
Oh, absolutely.
Yeah. And so we are here. We're going to talk about the shared responsibility matrix when it comes to cybersecurity in our clients. And, it's a key area for so many reasons, but we're going to jump a little bit more into it. But when we take a look at, shared responsibility matrix, why is this important?
Well, it's important because it's a key component for an MSP to start setting expectations and also protect themselves from liability. So when we get into what it is, it's basically just a definition of what the client's responsibilities are, the MSP's responsibilities, and then any third parties such as cloud services and what their responsibilities are. And I think everybody knows that you should be using a master services agreement to protect yourself against liability when you work with a client, and then you'll write up a scope of work for a project or for your services. So there's an understanding of what it is the client's asking for and what you're going to deliver. But what's often missing is this shared responsibility matrix, because there are things that the client has to do for you to be able to do your job, and you can't do everything for the client. And unfortunately, MSPs, and sometimes through marketing, say things like, well, we're going to handle all your cybersecurity.
Yeah.
By definition, that can't happen. And the shared responsibility matrix is the third key document. Think of a three-legged stool that can't stand up without all three legs. You need your master services agreement, your scope of work, and the shared responsibility matrix. If you don't have that, you don't have a complete set of documentation for the client.
And so, when I think about, one of the things we talked about this morning, actually, as we're going to get some breakfast, we ran into each other and we were talking about this particular topic. I think often MSPs are in that customer service mode of, I've got your back. We'll take care of everything. And that puts us in a bind, right? Because you want to create raving fans, and that's where I think the thought process is, hey, no, it doesn't matter what it is, Mr. Customer, Mrs. Customer, I'm going to take care of you, but that really puts you in a liable position.
Well, and it's also not completely fair to the client or the customer either. And let's take this away from MSPs and talk about going to the doctor. You go to the doctor and the doctor gets the results of your blood test and says, hey, you need to lose weight and get more exercise and maybe cut back on or change your eating habits because your cholesterol's too high. Your doctor would never say, I'm going to do those things for you.
Right.
Your doctor's going to say, I'm going to prescribe some things for you to do, and then there are things that I can do as a team. We can work together to get this done. But it's as simple as this, Dan. One of the first requirements in any of the cybersecurity frameworks and regulations is to limit access to authorized users.
Okay.
It sounds simple enough, but an MSP cannot do that for the client. And the reason for it is those last two words, authorized users. The client is the one that has to go through whatever their hiring and background check process is to decide that this new employee is worthy of being hired and given access to sensitive or regulated data.
Yeah.
So the client has to authorize the users and tell the MSP to implement or establish that access. And then the client is also responsible at the end of the person's employment to notify the MSP to terminate the access. So when you think of a shared responsibility matrix, it literally says limit access to authorized users. What's the client's responsibility? It's to authorize the users to get access, and then it's to deauthorize the users from access.
Yeah.
That can't shift to the MSP because they need the client to tell them those things. And then the MSP's responsibility is to establish the access and then terminate the access when the
Right.
client instructs them for that. If that's not clear and a former employee still has access and causes damage, that could create liability for the MSP, first of all, if they were informed. But the MSP has to be able to say to the client, you never told us that that person is no longer working there.
Right.
It's as simple as that. And then there are hundreds of other little examples of related to cybersecurity where the client has to do things such as physically secure their systems. You can't do it for them. This is where the shared responsibility matrix comes in. And then the big blind spot that we see with MSPs who say we're going to handle all of your cybersecurity is that every business that I've dealt with in the last 20 years, including when I was in MSP and since then as a compliance consultant, has run software, cloud-based software that some department decided to use and give people access to that the MSP never touches.
Okay.
So part of that responsibility, remember, limit access to authorized users, no part of it shifts to the MSP when it's the electronic health record system at a doctor's office or the enterprise resource planning ERP system at a manufacturing company or Salesforce or some other CRM tool. They do that internally. So the MSP, by using the shared responsibility matrix, makes it clear to the client where the guardrails are, or the borders are between their responsibilities and the client.
Okay. So for anybody listening, feel free to jump in with any kind of questions that you have. And Mike will be more than happy to answer them for you. Great opportunity to, get those, questions answered. But, I wanted to bring something up that, I was mentioning my dad just recently had a stroke and a heart attack, and he was in the hospital for 2.5 weeks before being moved to a rehab facility. And as I was walking down the hall, there was like an administrator's office off to the side. And I happened to peek in, as I was walking by. I wasn't like intentionally peeking in, but there was nobody in the office.
Yes,
There
you
were.
were.
Exactly. There were 3 screens. The computer was unlocked, and I could have literally walked in there and jumped on that computer. So there's example number 1. Number 2, in another part of the building, there was a laptop on a cart, logged right in. No employee around. Computer was not locked, and I was blown away. So when we talk about shared responsibility, we can put all the policies and procedures in place. We can put all the technology, tools in place. But at the end of the day, we didn't not tell them to lock that computer when they walked away from it. Now, sure, it should auto lock after a period of time, but, they walked away from that. And again, that shared responsibility, that's one example of where we can't control that, but yet at the end of the day, are we going to get pulled into the mix if there's an incident?
I'm so glad you asked that last question, because using those 2 examples, and I said this earlier, that the shared responsibility matrix always shows that the client is responsible for physical security. In those 2 cases, there was no physical barrier. There wasn't a locked door, for example, between you and that computer that was unlocked. And in fact, there was no person there. So sometimes a person being there, such as a security guard or somebody in the office who is there, will be the barrier from you walking in. So just having an unlocked door.
Right.
If you had seen a person in there, that could have been considered good enough physical security to keep you from walking up to that machine and doing something. But how does the MSP get dragged into that? So I'm going to go one step further, Dan, and say, let's say that healthcare facility was managed, didn't have its own IT department, but was an MSP client. So now something bad happens, and it could be you complaining, filing a HIPAA complaint, for example, or it could be an incident. And there actually was an incident not long ago, believe it or not, an MSSP, a managed security service provider in Oklahoma, was in a hospital and installed malicious software on a computer and got caught and actually got arrested. So
So
what
an employee of the MSP did that, right?
is just
So Eric was just saying an employee of the MSP, correct?
no. Owner of an MSSP business,
The owner?
Oklahoma, was was arrested for installing malicious software. So I'm not going to get into that case, but I'm just pointing out this is what you're describing isn't just theory. These are things that have actually happened. But here's where an MSP gets dragged in. First of all, let's say there was a breach. Okay, the client is going to go to their lawyer. So this healthcare facility is going to call their lawyer and say, hey, we just got accused of a breach, or we just got a letter from the federal government that they're investigating a HIPAA complaint and we need your advice. And it was cybersecurity.
Yeah.
Well, the first thing is we'll blame your MSP because they handle your cybersecurity. Here's their website. Here's their marketing. Here's the agreement you signed. So they're going to handle all the cybersecurity. So this is where the shared responsibility matrix becomes so important. But what really happens during these incidents, even if the MSP has no liability, like you're not going to get blamed for causing the incident, now there's going to be a laundry list. We need all these reports. We need all this evidence to provide to the investigators. So I've said that MSPs need to protect themselves against the mistakes their customers make in their agreements. My question is simple. Let's say that it would take 40 hours to put together all the evidence that the investigation requires, and this is your client, and this is something you didn't cause. You're going to spend 40 hours putting all these things together because your client's being investigated for something that they did, leaving the door open, for example, and you're going to spend the 40 hours. Who pays for that? And why should you pay for this if you're the MSP? But your client's going to say, hey, we're paying you $3,000 a month for managed services, and it doesn't say anything in your agreement that you're not responsible for that. That's where the shared responsibility matrix comes in.
Yeah.
And you can even put this in your terms and conditions that if it's an incident that was not caused by the MSP, now, if it is caused by the MSP and you can be a threat to your own clients, that's a different discussion. But this one is where if you're being called in to provide information for an investigation that wasn't caused by you, then it's outside of the scope of your managed services, and that can be billed separately or will be billed separately. What's the shared responsibility? Well, the client's accepting the responsibility in this case for paying you to provide all the information required for the incident response because you didn't cause it.
Right. So we do, for anybody that has questions, please feel free to jump in. Eric, I don't know if our audio was real low. I didn't have the right speaker on at the time, so I wasn't sure if you had a question. It was kind of silent.
Oh, well, me being silenced is always a good thing. No, I mean, let me think how I want to reformulate that.
Sure.
Yeah, I completely lost where I was going to go. Carry on, and I'll pipe in shortly.
Okay.
I'm sure.
The other interesting thing is while I was at the hospital, a non-technology related, we'll call it incident, in my opinion, came up where I walk into a restroom that was, like in a main common area, and there at the sink there were 3 red bags that said labs on them, and I could see sticking out of them like vials of blood, and they had stickers on them, and apparently the guy who was transporting these had to use the bathroom, and went into a stall, left these out there. Someone could have walked away with these. And
Mhm.
so again, I bring this up because I walked out, I found a hospital person and I told her, her jaw dropped. She was like mortified. And
You
but
rat.
there's that there's that human element, right? That, here is a non-technical thing, which is just as critical as a technical thing. And, it comes down to that human element and that education of people of, again, it doesn't matter what policy and procedures that we have in place, if they're not following it and the ability to verify and make sure those policies are followed, if that's not put in place, then that's huge. That's a huge open issue.
Well, it is. And Dan, what you may not know about that situation is that you were filing a complaint, if you will. You were
Yeah.
informing somebody that there was a non-technical violation of protocol.
Yeah.
Now, if that had been a HIPAA incident, so just seeing a vial with blood in it with somebody's name on it does not violate HIPAA because you need more information to actually qualify. But let's say that there was an investigation that had nothing to do with technology to start with,
Yeah.
based on the complaint. When the letter arrives for a HIPAA investigation, it says, and by the way, I've been the chief information officer in a hospital. So I've been there when those letters have come in, and I've also been a cybersecurity and compliance consultant helping clients when the letters come in. It says we're investigating your compliance with the HIPAA privacy rule, the breach notification rule, and the security rule. What you're talking about is something to do with the privacy rule, just not keeping general information
Sure.
protected. But the letter comes back and says we're also going to investigate you for your compliance with the security rule. That's the entire HIPAA security framework that had to do with that incident. But now the MSP can get dragged into it.
Right.
This is like the poster child for why you need this shared responsibility matrix, because again, you didn't cause it. I'm talking to you as the MSP. You didn't cause it, but you're getting dragged into their mess.
Right.
There was an MSP in Denver, Colorado, who set up an email server for their client, and the client's name was Hillary Clinton, and they got dragged into that investigation.
Yeah.
And there was a lot of information going back and forth, but I don't believe they did anything wrong by setting up the server and, whatever the root cause of that investigation was, but they got dragged into it. And the question became, who was going to pay them? She did end up paying them, as I understand it.
Yeah.
So this is not a discussion, a political discussion or anything.
Yep.
It was just another example of a situation where an MSP gets called by a client going, we've got this investigation letter or this subpoena or whatever, and we need your help. If you didn't cause it, then you should be paid for it. It's not part of your managed services. But unless you clearly state that, it's going to be hard to collect money from the client.
Well, that the MSP that took over for the former MSP with Hillary Clinton's email server, I've spoken with him several times, and they went through hell. I mean, just outside of all the security components of it, I mean, they had death threats.
I was told by one employee got out of his car in his own garage, and there was someone standing there.
Yeah, yeah. And
by the way, you're not going to. The shared responsibility matrix won't prevent that.
Right.
Yeah.
Yeah. But I mean, think about it. I mean, one day you're an MSP, you walk in, you have this opportunity that turns out to be, national news, international news, and, you've got a target on your back. And that's wild. Eric, did you think of your question?
I was gonna say two things about your hospital experience. A,
Yeah.
don't ever use that hospital again.
Yeah.
Because from being observant, and I'm one of those guys who just, walks around and has good situational awareness. And I would argue that's what you had was good situational awareness, where the average person probably wouldn't have noticed any of that.
Noticed.
But,
Right.
I heard two very systemic things that, multiple machines unlocked,
Yep.
that you just saw in your casual observation. You weren't even trying to do anything
Mhm.
nefarious. If you were trying to do something nefarious, I guarantee you could have found a great
Yeah,
opportunity.
exactly.
But that's an organizational maturity issue
Right.
to a degree, as well as a security issue. It sounds like at least a good number of employees don't take security seriously. And
Right.
when we had our granddaughter in the hospital at UC Davis, literally everybody, because I pay attention to those things too, man. I mean, they locked the machine with their key card when they left and when they
Yep.
and unlocked it when they arrived. I mean, they were like robots. It had been drilled into them to the degree that, this is a risk to our organization. And I never saw a machine unlocked.
Yeah.
So
So,
Eric, let me just argue with you a little bit with all due respect. I
sure.
was the CIO of a hospital. It was a really good hospital and had really good doctors. And when I got there, had really bad cybersecurity practices because they thought cybersecurity was like an annoyance and they didn't
It is.
relate it to, well, I know it is.
Yeah.
And it was expensive and they didn't really see the return on investment, all the things you hear every day as an MSP. But my challenge was to educate people and show them that patient care includes protection of their information and their data and so forth.
Yeah.
So I don't want to say don't use that hospital. This webinar was supposed to have been done, or this podcast was supposed to have been done a couple of weeks ago, and I broke my arm. And I ended up having surgery the day of the webinar, so I couldn't do it. But I didn't choose my hospital based on their cybersecurity practices. I
Right.
look at cybersecurity and what Dan went through as an opportunity to educate people. And I'm not just throwing those words out there because they sound politically correct. I think that they need to understand the linkage and also the risk. And this is where I have gone straight to the CEO of a hospital and said, you got a problem here. I'm a HIPAA expert. And if I wanted to become a whistleblower, I could have put out of business or cost you $1 million today.
Yeah.
So take this seriously. Here's what you need to do to fix these problems. And a lot of it gets down to politics. I'm talking about corporate politics, where as a chief information officer, chief information security officer, we wanted to set up all those systems with 2-minute lockouts or 3-minute lockouts because they were in close enough to public areas or maybe in a public area. And when Dan saw the computer on a cart, it's different than the one in the office. You can close the door on an office, but even the one on a cart, you can't have it lock out in 15 seconds. The nurse or doctor has to look at the cart, turn
Right.
around, ask the patient some questions, and then go back and maybe put some information in. So those were the ones where we educated them literally turn this thing around so it's not facing the door, or ask the family to move away from the bed a little bit so they can't see. Now, you can see your own record, by the way. It's not a violation if they're, in the case of your relative or his relative, to be in the room looking at that patient's record. It's another patient's record that would
Right.
be an issue that you might have access to. So as long as they're controls, but it's an opportunity to show that cybersecurity is now part of your care for people. And we see a lot of privacy regulations, not cybersecurity regulations, but privacy regulations coming in that give people more control over their data. This is where we need to educate the executive level that will make that, I'll call it the executive decision, that in the office, for example, the lockout's going to be maybe 5 or 10 minutes to limit the ability for somebody to walk into an unattended office and see that. But this can also go in the shared responsibility matrix. Go back to what we're talking about here. We have put in to shared responsibility matrices that it's the client's responsibility to approve, and you could be specific, such as lockouts that are no less than or no more than 5 minutes. Now, here's the thing: if they don't do it, You can't make them do it. If they don't do it, you can go back, if you're sued, for example, after a data breach and say the client, here's where we suggested to the client or told the client that they needed to shorten that lockout time
Yeah.
because this computer is in a public area or near public access. And they turned that down. That was their responsibility. Put that in the shared responsibility matrix. So part of the shared responsibility matrix is that the organization, this is the client organization, needs to approve and implement and enforce cybersecurity policies. So now if there's a policy that says you're going to use MFA or that we're going to have 5-minute lockout and the CEO says, turn that off for me. I am sick of my computer
Right.
locking, and every time I get off the phone, I have to put my password in or pull my key card out or
Yeah.
use my authenticator. You move that responsibility to them. They made a decision, which is fine, but now they have to live with the consequences, not you.
Yeah.
Yeah, did they
I
at
got
least have the privacy screens on the monitor on those carts? You couldn't see it
No.
from a certain angle? No.
No.
Holy
No.
cow.
Nope, not at all. Yeah.
I've got a question for Mike. Since you are an expert and then, you're going about life like the rest of us, and then you see something like that, and then you get a chance at a conversation with them, how does that usually go? Are they like, oh, wow, somebody said something about this, I guess we need to address it? Or are they dismissive, or does it go different ways, different days, or?
Well, it really depends on who you're dealing with. So that's why I'm not going to go talk to the nurse or somebody at the nurse's station using the example of the hospital, because they don't have the authority and the responsibility. I want to go to a C-level, and it's either CFO or CEO. And the reason I'll choose those is that CFOs deal with the money, chief financial officer. So when I'm presenting this to them, I'm saying, look, I've got two choices here, or you have two choices. I'm either going to report this or you're going to tell me you're going to do something to fix it. And by the way, if I come back in here again and see it a second time, I'm not going to give you the courtesy of warning you again. So this needs to be fixed. And I'm firm because, to Dan's point, this is a patient's information. His dad was in there as a patient, and his dad's information is sacred under HIPAA and only needs to be shared with people that are authorized to see it. So it's a fair conversation to have. We have had people be dismissive, but in my own business, years ago, I set up a fax number. And we don't use faxes. I haven't used faxes in probably, close to 10 years, but we had the fax number. And one day I got an alert on my phone that we got a fax. Now, we deal with healthcare clients, and healthcare clients, believe it or not, still use faxing. And once in a while, we would get some documents that were sent to us by fax. Well, I opened up this document on my phone, and it was the medical record from a mental health care hospital about a lady who was in getting her cocaine addiction habit treated. And this was supposed to go to a court under a court order. So I stopped everything and walked out of the meeting that I was in and called this hospital, looked up their phone number, called the hospital, got the CEO on the phone. And I said, this is a true emergency. And I explained this. I said, number one, I want to delete this record off my fax system, but I want to give you enough information so you know what happened. So I'm going to read some of the stuff to you. And by the time we were done, this CEO was like, can I hire you to be a cybersecurity consultant? Because I was explaining to him what the HIPAA requirements were, but also the mental health law requirements of his own state, because these are things that we have become expert in. Mental health laws, HIV, other types of information are protected by laws in addition to HIPAA. So when I got all done with this, they agreed that they were going to now go find the real phone number for the court and not make the mistake again. And I deleted the record. But this is where it seemed benign. And by the way, the person sending end would not have had any idea. I mean, if you press the wrong number on your phone and you maybe, to send a fax, what are the odds that the wrong phone number is going to be another fax machine?
Right.
That's what happened here. So they must have heard,
Yeah.
maybe heard the beeping and all this stuff that a fax was going through, never realized they sent it to the wrong number. But part of it's an educational process. Dan said, it gets down to humans. That was a basic human mistake.
Well, and people are careless. I mean, it's, we as humans are careless. I think back to long before we, dealt with anything cybersecurity, long before people had computers, for the internet. So back when I was in high school, gosh, I sound old. But back when I was in high school, a company that I started, the company name was Multi Products, real creative name,
Only sold one
but
thing, so that's where it gets creative.
right. But there was a credit union in our city called Multi Products Credit Union. And I had a business phone. I had an answering machine. And one day after school, I come home and I'm listening to my messages, and a lady says on the answering machine, "Hello, this is so and so. This is my account number. I need to have you move X amount of dollars from this account to that account." And here she's just giving her information, her account number for obviously Multi Products Credit Union to a random voicemail. And people don't think about what they're doing. And there's this, I mean, that's the scary thing, is when our, any end user at organizations that we're providing technology support for, technology management, cybersecurity, that's scary. I don't think we truly understand the risk and liability that we all have. And we've joked about this before. After we have these conversations, especially when we have these conversations with you, we all say, you know what? Forget technology. We need to get out of this business and go buy a car wash.
Well, no, I don't think so. I think the big challenge,
Yeah.
though, and it's come through in some of these conversations and some of the questions, is we're not in the technology business. This is the problem. When I asked MSPs, well, we're an MSP, we do technology. Well, no, you're not. You're a cybersecurity consultant or an expert that should be advising business owners on their risks and what they need to do.
Yeah.
I actually created a sales course called Risk-Based Selling, and it was based on things that I did. And these were just some skills that I learned along the way, which was to take either information specific to the client's business, if we had it, but if not, a related thing that happened, something real that happened, and say, well, what if this happened to you? How many times as an MSP do you get told, oh, nobody wants to steal my stuff, or we don't have anything
Yeah.
worth protecting, so they're not going to spend the money on cybersecurity?
Right.
So I would take an incident or a headline, and it doesn't, I've looked at headlines, I've done searches on cybersecurity incidents within the last 30 days, or in the healthcare industry within the last 30 days, or in the manufacturing industry within the last 30 days, and done some searches on them, and gone into a manufacturer or a school district or whatever the client was or the prospect, and said, hey, did you see in your industry newsletter? And by the way, I still subscribe to industry newsletters for other industries, not the one I'm in, but the plastics industry, the manufacturing industry, the healthcare industry, the financial services industry. So as MSPs, we get all of our own newsletters from all the different media companies in our industry. Well, look at the other industries. So I would call up the client or ask them in the meeting, did you see in Manufacturing News Today or whatever their big popular news site is, that there was a breach of this manufacturing company and they were down for 3 weeks after a ransomware attack? Now, all of a sudden now the client's saying, wait a minute, this is a manufacturing company because they're a manufacturing company. Wait
Yeah.
a minute, 3 weeks? My MSP's been telling me we're only going to be down for a day because they have a
Right.
great backup solution.
Yeah.
Okay. Now I'm reading to them a headline, and I would say to them, so if this happened to you, so they can't deny that it happened. I'm reading a headline to them about an incident. If this happened to you, what would be the cost of like a day's downtime? How many dollars do you bill in a day? And I had a manufacturer tell me it was $300,000 in billing that they did every day. I said, okay, so now you're down for 21 days. Okay, take out the weekends. You're not doing manufacturing. So take 300,000 times like 15 business days. That's $4.5 million. How much cyber insurance do you have? Oh, we have $1 million. Oh, so you lost 3.5 million. You may have business interruption insurance that may help with that. But let me ask you something. Those are the direct damages. So direct damage is literally if you're paying 100 people $20 an hour, you have $20,000 worth of hourly risk of downtime. That's the direct damage. You're going to pay out this money you can't recover. But I said to the head of the manufacturing company, if within those 21 days you missed a delivery for your
Right.
biggest client and they lost confidence and fired you,
Right.
what could that cost? And it was like, well, that'd be like $25 million
Hmm.
over the next 3 years. I say, okay, that's your bigger problem. So now we have a $25 million problem. Now, what did I do there? Number one, I asked them questions, and by giving me answers, they owned the answers. This is really important. I learned this back in the days of calculators, and I carried a little basic calculator in my case, and I would hand it to the person I'm talking to. And I would say, enter in how many employees you have, how many dollars an hour you pay them, hit equal, times whatever, and then hit equal. They're holding their number, literally holding the calculator. And I learned the trick was they had to own the number. So now when they told me it was going to be $25 million, it wasn't me telling them.
Yeah.
So when they did that, I would say to them, hey, you told me you have a $25 million problem. My solution to it is only $6,000 a month.
I love that. I
So-
really love that because, I'm sorry, I don't mean to interrupt, but, I think too often we're throwing out industry stats. We're throwing out these big grandiose numbers that I think a lot of times they're so grandiose, they're not geared towards, they're more enterprise number, not necessarily SMB. And people look at that and think, that's not me. But when you put it on them and they are owning that number, I mean, that makes all the world of a difference.
Right. So let's go back to the shared responsibility matrix. What do they own and what do you own? And they have to take ownership. The other thing, which I'll just say again because it's so important. When I was an MSP, first of all, I started in this industry before they ever called us MSPs, back in the late 70s. And it wasn't until the early 2000s that this term managed service provider came along, and that changed with the tools that we could use to deliver monthly recurring preventive services. When I started, everything was reactive. You'd set up a network and they'd call you when it broke. So we were in the break fix industry, and then we moved into the managed services industry. But all of those responsibilities still change or didn't change when the monthly recurring revenue prevention model came into effect. So an MSP's job is to prevent the incident. I mean, that's really what we're telling our clients we're doing as MSPs, and you're going to pay me this monthly fee to do it. Well, again, what's your responsibility as a client? You got to lock the door. You got to turn the monitor so people can't see it. You have to enforce the policies. So if an employee of that organization had seen it, there should be a policy that says you need to report violations of our policies. And that way it makes the other people in the company not be rats, but make sure that they're informing. And this gets down when you're looking at healthcare. I mean, let's go back to the fact you're in a hospital. There are things they do every day in the emergency room and in the OR, the operating rooms, to protect the patients. Would they ever, or should they ever, use the same medical instruments on multiple patients without sterilizing them? Of course not. Would they ever touch a patient without wearing gloves and a mask and goggles? Of course not. So when I work with healthcare people, I'll ask them those questions. And then it's like, well, why would you let somebody work on a computer without having a lockout? Why would you let somebody do this without having to put in, the second authenticator or the third authenticator, whatever, to get into the system? And you need to put it in their language and say you're not providing good patient care if you're not securing the patient's data properly.
Right. So, when we think through, you mentioned one thing as far, actually, before we went live, we started talking about, I mentioned that you're the expert. We're also talking about our certified, over here, certified business geek sticker. And Mike was asking, what's certified about that? And I'm like, yeah, it's just, it's just a sticker, it doesn't necessarily mean anything. But my question is, when we as MSPs put on our website different terms as far as what we do, that we're experts, that we're cybersecurity, gods, whatever the case may be, let's talk a little bit about that risk that we put ourselves in with the terminology that we use and how we paint the picture of who we are, because I think that can overshadow that shared responsibility, because it makes it look like we are the ones that are solely responsible. The way that we word things, the way that we, whether it's on our website or whether it's our spoken words, we might be setting the mindset, planting a seed to a client, a prospect, that we got your back. It's all us. Don't you worry about it.
So there's a lot in that question. And one of the things is that I learned a long time ago from an attorney who understands the MSP business very well, that every agreement and every scope of work you sign with someone should say this replaces any previous conversations, any marketing materials. It's called a four walls clause. And a four walls clause says everything we're doing for you is based on the four walls around this piece of paper or this contract. So you're absolutely right. And I've also talked to people in the insurance business, like who handle our errors and omissions insurance, that if we say things on our website and we don't deliver them under our insurance policy, there's a fraud exception. And the fraud exception basically says if you promise to do something and you don't do it, your insurance policy is not going to cover you. So this can void both your liability policy. It can also void your master services agreement, because a judge can look at that and say you were negligent. This agreement is if you're doing something and you're doing vulnerability scans and for some reason it missed a vulnerability or the scanner didn't pick up one of the machines out of 100 or something and that got attacked. That's where insurance comes in. But if you say, for example, and there was a lawsuit against an MSP after a ransomware attack, and I was doing a presentation at a Channel Pro event, and I wore a judge's robe, and I had a gavel with me, and I said to the MSPs, "You're the jury." And the room was full of MSPs, and I said, "There's a ransomware attack, and the MSP got sued for causing it. Who's guilty or innocent?" Of course, everybody yelled innocent, because an MSP should not be responsible for that, right? Well, I said, well, let me keep going and read to you some of the facts that came out or the allegations that came out in this lawsuit. The MSP promised to do quarterly business reviews and in 3 years never did one. The MSP promised to have systems patched and updated. And after the incident, a forensics company found that the systems weren't patched and updated. And as we went through this, it turned the entire jury of MSPs looking at a lawsuit against another MSP into guilty. And the reason for it was that they had not delivered just basic things that they promised. So when you look at your marketing, your website, your proposals and things like that, beware of those words, but also one of the roles that we see in banks and sometimes hospitals and other organizations is internal auditor. Internal auditor at a bank or a credit union, you mentioned a credit union, would be the person that understands the regulations and is an internal employee and does internal audits to make sure that they're meeting those requirements so they don't get caught in a regulatory audit. MSPs don't do that. And I've said to MSPs, and we did this in my own MSP business, first of all, we picked our clients based on risk and risk to us. Who was the client that brought in the most revenue? Who was the client that what was in a regulated industry, we would audit those every month, not complete top to bottom, but I would check a patch report for that client, for those top clients every month. Then we randomly picked other clients so that we could, at the end of, say, a year, say that everybody had been audited internally to make sure we were delivering on our services. I have assessed clients of MSPs in HIPAA projects and financial service regulation compliance projects, and systems aren't patched. Firewalls haven't been supported in 2 years by the vendor, and the MSP was clueless until we caught the client. And then it was ugly because the client failed their assessment because the MSP wasn't doing what they were supposed to. So
Yeah.
there's a lot of responsibility in what we do in this industry.
So when we want to scream to the world that we're the authority, right? It only puts us in a bad position.
Dan, here's what I ask MSPs all the time. Picture yourself in court. Picture yourself in court. Now, MSPs can deliver cybersecurity in 1,000 ways. If you do it yourself, decide on what you're going to do yourself. Maybe it's good, maybe it's bad. If you're in a peer group and everybody says, well, here's what I'm using, or here's what's in my stack, and here's how we deliver cybersecurity, and everybody agrees that as a group, that's probably the way we should do it. Now it's the people in that room that are the cybersecurity authorities. I believe in using frameworks, and specifically frameworks that are government-backed, not CIS, because CIS is not a government agency. It's a great organization, and the CIS controls are great, except for one thing. It's not the government. I use NIST in my business. We did the NIST cybersecurity framework. We now are working with CMMC clients using NIST 800-171. And the reason we use NIST is that NIST gives us the ability, and when I was an MSP, we did the same thing, to be able to say, here's the government standard and here's the evidence to prove that we met that. That took away the question of, well, who the hell are you and what are your certifications in this? We didn't have to defend that anymore. We said the government says this is what you should do to secure these systems, or the HIPAA regulation says you need to secure the systems this way, and here's the evidence we did that. If you don't do that, imagine yourself in court after your client got hit with ransomware and their lawyer told the client to sue you, your best client, the one, you know their kids' names and what baseball teams they play on and all that stuff. And their lawyer said to sue you because they're getting sued, and they do it. Imagine yourself in court trying to defend your cybersecurity expertise. That's where I think you want to be careful. And if you adopt a government framework and you use that and you diligently implement it, but also get your client, you can put this in the shared responsibility matrix.
Right.
The client will approve implementing the NIST cybersecurity framework. If they don't do that, or they don't allow all of it, it's on them. But that's your defendability, because none of us, I've been certified as an expert witness in court for HIPAA and cybersecurity. It's difficult to prove that. There's a very large burden on you to prove your experience, your education, your certifications before a judge will say that you're an expert. Remember, that's who you're fighting with, because I have been in those lawsuits where I've been an expert witness or an advisor to a law firm saying, go ask the cybersecurity question, or go ask the cybersecurity guy that's on the stand or in the deposition this question. And that's what's caused these lawsuits to be settled.
Any questions out there? Or comments or experiences that relate? We have
Something kind of related that happened to me this morning. I got a PCI compliance thing they wanted me to renew, and I'm using WisePay. Okay, so I handle credit cards zero. WisePay, I put a link in my invoice that directs them to pay through WisePay. So they wanted me to put in an IP address of my web server or my office or something, so they can do a PCI compliance scan. Does that make any sense to anybody? Like, what are they? How could, I can't see how it could help anything, but it could only just make things muddy as to if there were an actual incident.
With PCI, there are different levels that it basically gets down to like what.
Yeah, so they did the
questionnaire-
questionnaire and they said, okay, because you checked off that you don't actually handle cards and stuff, you use a third party link, we're gonna throw you in PCI A's. And
Okay,
or SAC A or whatever it was. So I'm like, okay, but then they still wanted to scan something. They wanted me to give them an IP of something to scan, and I don't understand
Which would be
why.
unrelated because it is third party, you know, it's not going through your website, it's not
Exactly.
going through office,
Well,
et cetera.
but it's on one of your endpoints, which would be your server though, right? Your web
No, it's
server?
on ConnectWise's server. I'm
Give
hosting.
them that IP.
Yeah, so it's cloud-based, you know, it's not, you know, it's a third-party cloud-based service, you know, and it doesn't touch your web server whatsoever, or even, you know, your office servers or computers.
Yeah,
per
but
se.
it wanted like my website IP, and it wanted the website for and it wanted my domain IP, and I'm like, oh, why?
So the challenge with PCI is that you're dealing with a merchant processor, and whether it's directly with you or through a service, if it's through ConnectWise or someone else. So the money from a credit card ends up coming from a bank, but it always goes through a merchant processor. Those are the people that we've always talked to find out what the proper questionnaire is for the type of business that we're working with. And they're the ones that have had the answers on what needs to be scanned or what needs to be approved or whatever. So this is something that I would go back to, I'd go to your next level upstream, if it's ConnectWise or
Yeah, that
if
was
if
the first time I got the survey. I wrote them back and I said, you've got this all wrong. I'm not handling credit cards. I just hired WisePay. Go PCI compliance them. And they weren't having it.
who
So
was they? Was this the PCI council or who was it?
Lewis, I think was the name of it. Merchant Protection Program, Global Payments Integrated.
Okay, so they're a payments processor. So
Yeah.
But how are they related to you? How is,
That's the thing. That's what I wrote them. I'm like, no.
Yeah, like,
and they're like, well, you signed up for
WisePay.
WisePay, and we protect WisePay. And I was like, okay, go scan WisePay. And they're like, oh no, but you're using it. And I'm like, I add a link to an email for an invoice to be paid. I don't handle credit cards.
so my question on this is, what authority does this organization have over Mike? Because like, who are they and who are they in relation to Mike? Are they, because it's one thing if a credit card processor sends you a PCI form to complete.
well, this may be so if you're looking, when you're dealing with PCI and they talk about scans, it's not just anybody that can do the scan. It's an authorized scanning vendor that gets hired by someone, the merchant processor or whoever, to scan the network. So first of all, there's an approved list of people. Nobody can just say, I'm going to do a PCI scan for you. And you're working for somebody. So it sounds like they may be working for WisePay and just being their scanning vendor. And if that's the case, and ConnectWise is involved, because now it's a third party to you, not necessarily to your equipment, I would be talking to ConnectWise and find the people that are responsible for that payment integration process and talk to them and find out what's doing. It may be an absolute legitimate request in terms of whatever remember when we talk about websites and servers, this is why I hate the term cloud. It's a server in a data center someplace. So that link is someplace in a data center on a server, that links to your payment system. The question becomes who controls that and is it appropriate for them to be scanning it? I would get ConnectWise in this case involved in that conversation if it's their environment and they must have somebody or a team of people that deals with that payment system that understands PCI and can communicate with that.
I mean, that is my question too, is did the communication that came from them say, we are working on behalf of ConnectWise or on WisePay, on behalf of WisePay? Or is this just some bogus request that came through that someone has no authority whatsoever to be even asking you, about?
Exactly. That was the first time it came through. That's when I kicked back on all that and said, what is this about? Actually, I thought it was for one of my clients because I do have a client that we have to do that stuff for them. And so those emails would come into our help desk but it never identifies the client. It has their merchant ID in there. So I thought it was for them. And I'm like, I just did this last month and I logged in and I'm like, yeah, it says it's done. And I'm like,
yeah,
hey, we just did. And they're like, no, this is for you. And I'm like, wait, what? And then tracked it back down to WisePay.
Gotcha.
Yeah.
All right. Interesting. All right. We are at the top of the hour. One last tip.
Remember the three-legged stool that can't stand up without all of its legs. You need a master services agreement. That's the fine print terms and conditions. You need a written scope of work or engagement letter, whatever you call it, which describes the project and puts some guardrails around, what's included in the price and the services and all that. But if you don't have a shared responsibility matrix, you've not properly set your client's expectations, you've not properly protected yourself. And remember that you are not handling all of your clients' IT and their cybersecurity because every one of your clients is using some sort of software program like an online payroll system or an HR system or a customer relationship management CRM system like Salesforce or an electronic health record system or a manufacturing system that you don't manage. So put that in your shared responsibility matrix that they're responsible for all those things. Last thing is you can leverage that for additional services. So here's an example. We did a study, or we did a project to evaluate a medical practice that a private equity company was looking to purchase. And they were managed by an MSP. So we asked the MSP for the Active Directory user list. We asked the client, the medical practice, for the current employee list and the list of users on their electronic health record system. So we looked at the current employee list, compared it to the Active Directory user list, found a couple of people out of a couple of hundred employees, so not very many, that shouldn't have had access. Now that was wrong, but 2 out of a couple of hundred, that's margin of error percentages by comparing the current employee list to the Active Directory user list. We then compared the current employee list to the electronic health record system user list. 177 former employees still had access. And that was a huge. And what we found out was that the person in the medical billing department who was responsible, I don't know how they picked this person, to add and delete users from the electronic health record system didn't know how to do it properly. Here's my point to you as an MSP. When you say you're handling cybersecurity for a client, it's the same skill set to look at the current employee list against the Active Directory list you manage and look at the same employee list and compare it to the list of active users on their electronic health record system list that you don't manage. You can charge more and say, we will take on the cybersecurity not the management, like adding and deleting users, but the evaluation of your cybersecurity with the systems we don't manage. That's an opportunity for you to expand your services, become more of a consultant and business advisor than just the MSP fixing stuff and protecting the systems you manage. And you can charge more for that. I did that.
Awesome. All right, everybody. Starting to get a little loud in here, but we are going to wrap up. Thanks for your time, Mike. And of course, Mike Semmel Consulting. And you can look up Mike. He's available for cybersecurity, everything cybersecurity. You guys have a variety of things that you can help MSPs with. And you can look them up, find them on LinkedIn. With that being said, hope everybody has a great rest of your day. And
Thanks,
we'll talk to you
thanks again, Dan, for bringing on another guest that makes me want to switch careers.
soon.
Oh, you've got a great career. I'm just helping you do it better.
Exactly.